Hi, this is Dr. Saxena, and I've been talking about something for autism, and this particular segment is dedicated for autism. And what I'm going to hear, what you are going to hear, is my opinion. It is based on treatment of hundreds, probably thousands of patients with heavy metal toxicity, and it's based on a clinical science. It's based on basic science and small clinical studies, inference and extrapolation, and not large clinical trials which are urgent necessary. Uh, we need to take up that large clinical trials. Let me begin. It's based on treatment of my own son, and it is this particular thing is focused on mercury, but applies equally to lead, arsenic, and some other antimony or something like persistent organic pollutants as well. So when we talk about what you have to offer for autism, when it comes to autism treatments, by FDA standards, all treatment for autism is off-label, meaning they have not approved any treatments for autism. Every treatment is therefore at the discretion of the treating physician and the parent or the patient. So, however, the subcomponents like allergy, you have something like inflammatory bowel disease, you have got something like vitamin deficiencies, etc. They do have this FDA approval. So when I'm treating inflammatory bowel disease, when I'm treating allergies which the autism patient have got, we do have a AD approval. And apart from autism, we have something ADHD, which has numerous approved medications for children, whereas for autism spectrum, none. Um so they, so this is the kind of first disclosure I would like to tell you, because we are all working with this off-label medication, off-label treatment of, we are trying to use some off-label use of other drugs which is probably used for some other something like antifungals or something like that, which was not FDA approved for autism. Here I'd like to quote something about a thing called precautionary principle, and when I talk about things of precautionary, I must be very clear. We as physicians must act on facts and the most accurate interpretation of them using the best scientific information. That doesn't mean we have to sit back until we have 100% evidence about everything. When the state of health of the people is at stake, we should be prepared to take action to diminish those risks even when the scientific knowledge is not conclusive. This is the 1998 paper which was produced, which was presented in, it was a Lancet paper by Dr. Horton. This is exactly called precaution principle, and what I do with this principle. So when I'm talking about autism, I will be listing what is biological different, what are biological different things which happen in autism. As I started about inflammatory bowel disease, you have got persistent measles, you have got reflex esophagitis, you have got leaky gut, you have got food allergy, you have got heavy metal burden, uh, brain autoimmunity, you have got dysbiosis, you have got thrombophilia, a lot of stuff. Apart from that, I look into something like seizure. People do present with seizure or sensitive issues. People do present with something like perfusion defects, omega 3 defect, elevated ammonia, you have got serotonin defect, sulfation defect. Some people have melatonin defect also. These so many things are biologically different in autism. So none can be ignored, but we need to prioritize. Progress requires attention to details All issues must be addressed eventually. The priority is unique to each child. I believe a gut is the generally the best place to start. Not just gut. I think sleep is the first, which usually both are things. If the gut is healed, sleep also will be proper. So these are the areas remedy kind of thing I would like to start first. Um, when I talk about gut issues, I need to focus on the core focus. Inflammatory bowel disease is the major problem, which we call it as a autistic enterocolitis. And usually we had seen there is a problem with the measles kind of stuff. And yes, there is a thing called opioids. You have got dysmotility, where the patient may present with constipation, diarrhea, or reflux. The patients usually have leaky gut. Leaky gut is a big term which I would like to think as discuss in detail, and it's a simple thing which keeps on. Um, that's a problem with the. That's the reason we asked wheat and milk should be avoided in this particular thing. And you have one core issue is a dysbiosis. It can be fungal dysbiosis, or it's a bacterial dysbiosis. A lot of symbiotic bacteria. They're not good bacterial flora is altered here. When I talk about autism, I talk about something like biomedical treatment. Biomedical treatment is reducing neuroinflammation by enhancing natural detoxification pathways. This may improve the clinical scores of the autism spectrum disorders. So we have three things at a place. One is brain nervous system, you have got a gut, and you have got an immune system. See, we need to work at all these three things and reduce this inflammation. So the treatment essentially deals with toxic environment, toxic food, nutritionally deficient foods, immune systems which are skewed immune systems, which are overstimulated, and you have got something like oxidative stress. So when we talk something about general principles of detoxification, I would rather go like this. The first thing is reduce the toxic load, which is minimize exposure. We need to see that ongoing toxicity should be addressed. Increasing the mobilization. Mobilization is toxic of this toxic metal. Usually chelation is as necessary if you can take it, or working with maximize the biotransformation. Maximum biotransformation, we try to work with the balanced, and you need to see that your liver detoxification is proper. So yes, minimize the things which causes more damage to the body, or whatever. If we are able to reduce the oxidative stress, that's a good thing. We would like to go into some more things, preparation for things, but I think this is the how we try to deal with autism, which is called biomedical treatment. And treatment consists of a lot of stuffs, and it's a very it happens in a graded manner. You can't although you need to do some jump start, but you have to go very methodically, trying to see that the child is getting detox, the detoxing skills are improving. At the same time, trying to work with a lot of essential things, which are supplements usually. They have a host of supplements which we'd like to do for these children. And mostly all these supplements, I can tell you, it is not causing any harmful side effects. You have got something like simple supplements which are probably not very something like some B vitamins, or something like glutathione, something like a branched chain amino acids. So things are quite simple here, and along with that we try to work on something called We try to take when we correct the biochemistry, we try to work with the physiology, and this physiology we work while doing, trying to correct that oxygenation and all that. That makes a difference as such. So this is the essence. This biology of detoxification, where we are trying to look into genetics, environment, and nutrients. And I somehow believe there is a central role of methylation and sulfation in health, and in this particular aspect. This is how I try to deal with autism, and this is the way I proceed for working with a autistic or ADHD or a kind of learning disabled kid, trying to work on this particular stuff, and see that if I am able to improve the child to some extent. I don't claim I am going to cure the person, because some things are definitely we believe all neurotypical kids also do some problems. There is a huge amount of things, and if I am able to see that the child starts talking, the child is getting into the school properly, is mixing well with the parents as well as the other kids, I think I take that as a good success. And this is how I can help autistic kids, ADHD, as well as the learning disability. And this is our protocol which I work. Thank you.